Thank you very much for your time, Ms. Barnes. Now, just firstly, we know that these Johnson & Johnson vaccines are still awaiting approval. How far is this, especially because unions are expecting their members to start being vaccinated by Wednesday or from Wednesday?
Good morning, Masego. One more. We are still waiting because we were told last week on Friday when we had a meeting with the DPE that the vaccines will be released on the 7th today, that is the Monday. But unfortunately, we also heard that now there are hiccups there and there. So we're still waiting because we understood that our members or the teachers were supposed to be vaccinated from the 9th. So therefore, we are just going to be patient enough and waiting for them to bring the legit one, the ones that are proper for the teachers as well as the people that are working at schools.
Now, the support staff part of it is very important, and I'm sure the unions agree that not only teachers should be getting vaccinated, but those who also work at the schools as well.
Exactly. We also felt that those people that are working at schools as well should be vaccinated because it will be just a drop in an ocean if we're only going to be vaccinating the teachers. They're also in contact with each other. For example, we understand that the Department of Education or the Department of Health, they have mentioned that they are also going to be vaccinating the teachers that are from 40 years of age and above. But our worry is that why there is a segregation of teachers, why is there a segregation between the sectors themselves? Because if you look at the in health, everybody was vaccinated. Then why the teachers, they have to say from 40 years and above? And what about those teachers that are below the age of 40 but with comorbidities? Because they are also going to suffer the consequences. So therefore, we are also in dilemma by saying that teachers, only those above 40 that needs to be vaccinated, as well as the cleaners, they also need to be vaccinated as well. That is what we agreed upon when we had a meeting.
I think a lot of people are confused about the vaccination rollout, especially considering that government has been admitting that it's been a bit slow in terms of vaccinating enough people or at the time that they expected. Elderly people over the age of 60 are supposed to still be vaccinated now. What would you say to people who say teachers over the age of 40 are skipping the queue for those who are 60 and above because they too are now waiting for the next doses?
Yes, what I can say is that they are not actually skipping the queue, but because it is very imperative for teachers. They are working with learners. They are working with the community. So they also need to be vaccinated in order for them to be safe. So therefore, what we are looking at is that everybody needs to be safe in all spheres. If the teachers are not vaccinated, how are they going to go to school? How are they going to teach? So therefore, we perceive that everybody that works in education sector needs to be vaccinated for the children themselves to be healthy, as well as the parents at home. Because if the learners are going to come to school and then being infected by the teachers themselves, they are going to take the virus back home. So therefore, if the teachers are healthy, teaching in a healthy environment, then everybody will be safe.
All right, thank you very much. Let's leave it there. Cynthia Barnes, she is the Secretary General or General Secretary of NATU.